again. Hi. Uh, no one will probably ever see this, but I'm still studying for the NCLEX. So, we'll see. And yes, that is in fact the aquatic theme from Donkey Kong, but hopefully it'll help me focus. If anyone cares, I'm using this textbook that I got from my school like the last 2 weeks before it ended to help me prepare. So we'll see how this goes. Let's see. 11:48. I probably won't be studying for too long, but we will see. And again, not that anyone will ever see this, but if someone did happen to see the first one, I have been studying in between. I just didn't film it. So, medications for cardiovascular. God knows, farm is. Let's see here. Okay. So, I'm just gonna say stuff out loud, I guess. We'll see. So for TPN, serum glucose, you should monitor every 4 to 6 hours. Change gauze dressing Q2 days, transparent dressing Q7 days, IV tubing every 24 hours. And if the TPN solution is temporarily unavailable, you give D10W to prevent hypoglycemia. Okay, let's see. Oh, yeah. So, antidote or reversal agents. So, acetaminophen, you're going to give acetylcysteine. Benzodiazepine, you give flumenazole. Curare, I don't know how to say that. You give edrophonium, cyanide. Hello? Cyanide. You give methylene blue, digitalis, digoxin fab, digifab. Ethylene poisoning, you give fomepizole. Heparin and enoxaparin, you give protamine sulfate, leave heparin to the pros. Iron, you give diferoxamine, but if you know iron, the other name for it is like ferrous sulfate. That's why it's diferoxamine. Lead, you give sesamer. Magnesium sulfate, you give calcium gluconate because calcium and magnesium, those are your opposites. Any narcotics, of course, you give naloxone, and warfarin, you give vitamin K, which is also called phytonadione. Don't know if I'm saying that right. We'll go with it. Okay. Oh, yes. Common drug class suffixes. Calcium channel, Calcium channel blockers end in dipine or dipine, so amlodipine. Any erectile dysfunction meds is Afil, sildenafil. Um, Anesthetics end in cane, novocaine, lidocaine. ACE inhibitor, Pril, enalapril, mm, tons. Benzodiazepine, and in PAM or LAM, alprazolam. Uh, Anti-lipidemic, Asone or Solone, prednisolone. Uh, no, excuse me, anti-lipidemic is statin. Why? I can't read, apparently. So any statin, atorvastatin, anything like that. Now, corticosteroid is Asone, Solone. Beta blocker is Olol, metoprolol, anything like that. Penicillin, of course, ends in cillin. Oral hypoglycemic ide, proton pump inhibitor or PPI ends in Prazole. Antiviral ends in Vir, acyclovir. Thrombolytic ends in ACE, ASE, alteplase. Antiemetic ends in azine. Bronchodilator ends in phylline, theophylline. Anticoagulant ends in arin, ARIN. Enoxaparin. Anti-ulcer ends in dine, DINE. Antihistamine ends in zyne, ZINE. Antibiotic ends in cycline, like okay. Aminoglycoside ends in niacin, neomycin. Antibiotic ends in fluoxacin. Tricyclic antidepressants ends in Tyline, and SSRIs end in pram or ine. Now, for ACE inhibitors, you want to be monitoring for angioedema. For benzodiazepines, you want to be monitoring for anterograde amnesia. For beta blockers, you're going to be looking for bronchospasms. For ciprofloxacin, you're going to be looking for a tendon rupture. For digoxin, you're going to be looking for a yellow tinge to the vision. Um, for doxycycline, you're going to be looking for tooth discoloration. For furosemide, you're going to be watching for hypokalemia. For lithium, you'll be watching for tremors. For tobramycin, you're going to be watching for ototoxicity. And for valacyclovir, you'll be watching for thrombotic or thrombocytopenic purpura. So little like points. Mm-hmm. Let's see if so. Let me see here. Okay. So let's see. This is just okay. Interesting. All right. Saw a word I didn't know, so I had to look it up. Let's see. What's next? Medications for the cardiovascular system. So we've got antihypertensives. So teach them to take their meds at the same time each day. Don't discontinue med abruptly, which pretty much goes for most everything you're going to see. Prevent orthostatic hypotension. So basically, when they stand up too fast and get dizzy. Okay, so you've got ACEs and ARBs. So angiotensin converting enzyme and the angiotensin 2 receptor blockers. So your ACEs end in pril, and your ARBs end in like sartan. So it's used for hypertension, so high blood pressure, heart failure, MI, diabetic nephropathy. Monitor the potassium levels. Use with caution if diuretic therapy is in place. Potential side effects and adverse effects are persistent non-productive cough. That's with ACE inhibitors. So your prils, like your captopril and allopril. Angioedema and hypotension. Basically, it does its job too well, and the blood pressure like drops. Should not be used in second and third trimester of pregnancy. Captopril, if you're using captopril, should be taken 1 hour before meals. And again, monitor their blood pressure. That's the whole point. You want to make sure it's working. And monitor for angioedema. And then, of course, if they do have it, give the epinephrine, give epi. With calcium channel blockers. So things like nifedipine, diltiazem, verapamil, amlodipine. That's what they got in here. Again, used for angina, hypertension, and verapamil and diltiazem. Which, if you guys are learning anything about it, again, not that anyone's watching, but if anyone starts going into like the cardiac section, you will see it being used for AFib, A-flutter, and potentially SVT. But SVT, there's things you're going to be using for that. The other meds. Use cautiously in patients that are on digoxin and beta blockers. It is contraindicated for clients who have heart failure, heart block, or bradycardia. And there's toxic effects when consumed with grapefruit juice. So this is one of the ones we don't use grapefruit juice. Side effects and adverse effects. You've got constipation, reflex tachycardia, peripheral edema, and then of course toxicity. Monitor heart rate and blood pressure. So some of these sympatholytics or alpha adrenergic blockers, um, it like dilates the veins and arteries basically so that it drops blood pressure. Some of those will be prazosin or doxazosin mesylate. So it's used for primary hypertension, and doxazosin mesylate may be used in the treatment of BPH, benign prostatic hyperplasia. Um, Precautions and interactions: there's an increased risk of hypotension and syncope if given with other antihypertensives, beta blockers, or diuretics. But of course, because if you're combining two things that do the same thing, it's just the strength gets more as compared to just one. You have two, so it's of course. Let's see here. NSAIDs may decrease the effect of prazosin, so NSAIDs. Uh, side, side effects and adverse effects is dizziness and fainting. Again, monitor heart rate and blood pressure. Take the medicine at bedtime to minimize effects of hypotension. Um, Centrally acting alpha 2 agonists like clonidine, methyl-dopa, and guanfacine hydrochloride. It's used for primary hypertension. It may be used in combination with diuretics or other antihypertensives. It's also used for hypertensive crisis and severe cancer pain. So, let's see. It's contraindicated with anticoag therapy and hepatic failure. And we're not giving it to clients taking MAOIs. Um, Women that are lactating should not use it. Side effects: dry mouth, drowsiness and sedation, rebound hypertension, black and sore tongue, and leukopenia. So, monitor for adverse CNS effects, monitor the CBC, the heart rate, and the blood pressure, assess for weight gain or edema, monitor closely for rebound hypertension when the med is discontinued, about 48 hours. Don't skip a dose, take at bedtime. Let's see. Hmm. Let's see here. Hmm. Okay. All right then. Okay. Don't know what that was. Notification for something. Let's see. God knows I can't focus on farm. So This is the only one that I have that's this hard to open. It's fine. Antihypertensives. So, cardiac glycosides. So, treatment of cardiac failure or ineffective pumping mechanism. You got digoxin. It's used again for heart failure and AFib. Thiazide or loop diuretics increase risk of hypokalemia and precipitate dig toxicity. And again, the what you would give if there was dig toxicity would be digifab. So don't mind the fact that I'm pretty much just rambling to myself right now. ACE, ARBs, increased risk of hyperkalemia, and verapamil increases risk of toxicity. Thiazide and loop diuretics. So, because those are potassium wasting, while spironolactone is potassium sparing. So then you want to monitor for hyperkalemia. But even still, you don't want to decrease the amount of potassium or increase if you're on like a thiazide diuretic. You want to keep it about what the patient normally has, so they're not gonna start eating a whole bunch of things with vitamin K in it all of a sudden. It's not the time. Let's see. Medical pulse, dig toxicity, hypokalemia, hypomagnesemia. Maybe. So, dig toxicity, importantly, it looks like anorexia, not wanting to eat, nausea, vomiting, abdominal pain, fatigue, weakness, diplopia, double vision, blurred vision, yellow green, or white halos around objects. So, Do I have another highlighter? Because clearly this one is struggling. Yeah. So yellow. Fits, I suppose. So anorexia, nausea, vomiting, abdominal pain, fatigue, weakness, diplopia, blurred vision, yellow, green, and white halos objects. Is ditch toxicity. And again, if they get ditch toxicity, give Digifab. Okay, anti-anginal medications. Okay. Use of organic emulsions. Da, 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 da. So, okay. Sublingual tablet, sustained release tablet, transdermal ointment. Transdermal unit is a patch. So it's used for acute angina attack or used prophylactically for chronic stable or variant angina. It's contraindicated in clients with a head injury, hypotensive risk with antihypertensive medications, of course, and contraindicated if taking ED meds, erectile dysfunction meds, because of life-threatening hypotension. So you're going to be monitoring for headache, orthostatic hypotension, reflex tachycardia, and tolerance to the med, meaning it no longer works. Like they would need more of it for it to do what it needs to do. Nursing interventions and client education. Nitrostat, nitrolingual. Rest for 5 minutes, if not relieved by first tablet. Then call 911, take the second. You can use up to 3, taken 5 minutes apart. Keep in original dark container. Anything that's kept in a dark container is kept in that kind of container for a reason. So don't just transfer it to like some see-through Tupperware or something. I don't know. You see crazy stuff. But don't do that. It's in a dark container for a reason. The light messes with the medication, basically. Nitrolingual may be used prophylactically, so like to prevent beforehand, basically, 5 to 10 minutes before exercise. Don't shake the nitrolingual canister because it makes bubbles and then it's not as effective. Of course, MedAlert bracelet. For NitroBid, which is the topical ointment, you're going to wear gloves. Don't massage or rub. Apply to area without hair, chest, flank, or upper arm preferable. Cover the area where the patch is with clear plastic wrap and tape in place, and then gradually reduce dose and frequency over 4 to 6 weeks. And for NitroDur, which is the transdermal patch, skin irritation may alter the medication absorption. So again, don't put it over irritated skin, anything with obvious issues on it. Optimal locations are upper chest, side, pelvis, and inner upper arm. Rotate sites, usually warm for 12 to 14 hours, and then it's removed. Antidysrhythmic agents. So we got adenosine, amiodarone, atropine. So and sure I have my notes somewhere. The question is, which notebook is it in? I have many notebooks. So I made little stickies for when we were going over like cardiac things. in this one. Maybe I put it in my other one. It's fine. It's daijoubu. Okay. It might be my other notebook. But basically, what meds did I just talk about? Adenosine or adenosine, to me, for anyone doing cardiac, is like for adenosine is for SVT, because that's your supraventricular tachycardia. So that's the one where it's just all sorts of wonky. If I can, maybe it was this one. Pull up, because I drew supposedly what it was going to look like. It's this. I literally just took what they had in class and just drew it myself. Sorry, let me move it. SVT looks like that. And you're going to give adenosine. Don't mind my handwriting, by the way. I was trying to write all this stuff down in class. But yeah, so that's SVT. And you're going to give it for that. And the way I remember that is SVT is going just extraordinarily fast, and like you don't want it to, they're going so fast that you don't need a gradual slowdown. You just need it to chill out. So for me, adenosine or adenosine is kind of like ancine when you do anything with like theater. I was a theater kid. So it's like ancine. So ancine means you're finished, like ancine. You're done. It's cut off. You're done. That's it. So that's what you're trying to do for SVT. So SVT, you give adenosine, ancine. I don't know if this is going to help anyone, but this is what I did to help me with these. Amiodarone, you're going to slow stuff down. So let me see if I have in here. Oh, I'm sorry, that's protect fib. Where did I put that other one? Maybe I put it in here. My brain's leaving. I swear it is. Which means, aha. Okay, so for VTAC. There it is. Staring me in the face, and I'm pretty sure I even said it out loud, but so VTAC is the one where it literally just looks like squiggles right here. If I can move my finger. VTAC. It literally just looks like little squigglies. So that's what VTAC will look like. And you give amiodarone. Sorry. You're going to give amiodarone because it's going to slow it down. But it's not going to do how SVT does. Let's see. And what was the other one? Atropine. Atropine. So atropine is used for bradycardia. So it's the one that brings your heart rate up. Now, I thought of this one. It's kind of stupid. Well, they're all kind of dumb, I guess, but whatever works to help you get through it and memorize these. For me, when I was doing atropine and it's for bradycardia, I knew bradycardia was slow heart rate. Anything with brady means slow or low, and anything with tachy means high and fast, basically. Um, so for bradycardia, I know it means slow, and I thought, oh, Brady likes the pines. I know it's just, I know it's stupid, but it's like atropine, pine, Pine, ends in that. So he likes the pines. So like, oh, he's going out, you know, he's going out to the woods for the forest. That's what he loves. That's what brings him joy. And usually when, you know, you love something, you're joyful, whatever, I think like, oh, like you can feel your heart beating faster because like, I don't know, you just get excited basically. Um, so that's what it does. It makes it go faster because usually he's like low, slow, and chill because he's not loving life. Um, so he goes out to the forest, sees the pines, and then that's yeah. Anyway, don't mind me. Atropine bradycardia. So yeah. Oh, another thing is again, not that anyone's watching, but adenosine, the ancine for SVT, is it slows your heart rate down so much so quickly that it pretty much stops for a hot second. So if you ever see it and they give adenosine, um, they'll push it, and then you're stood there waiting, like holding your breath, because it pretty much stops and they've like flatlined. And you're like waiting for them to like take another breath, and they finally will take a breath, and you're like, oh, thank God, and then they come back. So that's adenosine. So don't be like surprised when you go see it in action for the first time. Yeah, really crazy. Yeah, that's what I got for those. Um, yeah. Let me return. Is it this textbook? No, textbook, notebook. I speak English. Not really. Sorry. Back to you. Okay. Um, brain also. Let's see. Okay. Oh, sorry. All right. Anti-lipemic, lipemic, LDL, your cholesterols, your statins. Now, your cholesterol meds, so atorvastatin, simvastatin, rosuvastatin, pravastatin, lovastatin, whatever. Um, my dad's actually on a statin, which is kind of crazy to think about, but kind of like the main stuff you would need to know. I feel like side effects, adverse effects, excuse me, would be muscle aches, hepatotoxicity, rhabdomyolysis, and peripheral neuropathy. Let's see. Ah, yes. Meds for the respiratory system. God bless. So, respiratory system. We've got beta 2 adrenergic agonists. So, we have your albuterol, which is your short acting. We've got your salmeterol or formoterol, which is your long acting. We've got terbutaline, if I can speak English, terbutaline, which is long acting. Right now, that's what I got. Yeah, because those are your beta 2. Let's see. Side effects: tachycardia, palpitations, and tremors. Be on the lookout for those. Um, Caution against using salmeterol more frequently than every 12 hours. So, salmeterol. It's contraindicated for patients with tachydysrhythmias. So, again, any of those SVT, anything tachy. Um, Caution with diabetes mellitus, hyperthyroidism, heart disease, hypertension, and angina. Beta blockers will reduce their effects, and MAOIs will increase their effects. MAOIs increase, beta blockers reduce. Okay, methylxanthines. So it's like bronchodilating, basically. So you got aminophylline and theophylline, um, relief of bronchospasm, and it's long-term control of asthma. They could have irritability, restlessness, and toxic effects. Importantly, is tachycardia, tachypnea, and seizures. Avoid caffeine. Smoking will decrease the effects. Alcohol will increase the effects. Hello, my love. Um, Treatment of toxicity. So again, that tachycardia, tachypnea, and seizures. If they do have that, stop the parenteral infusion, activated charcoal to decrease absorption in oral overdose, lidocaine for dysrhythmias, and diazepam for seizures, of course. Um, Inhaled anticholinergics, again, bronchodilation. So you've got ipratropium and tiotropium. It prevents bronchospasms and manages allergen or exercise-induced asthma and also COPD. Contraindicated for patients with a peanut allergy because it has soy lecithin. Use extreme caution with narrow angle glaucoma and BPH. Do not use for treatment of acute bronchospasms because this is why is my brain leaving me? Acute bronchospasms because it's long acting. So, side effects: dry mouth and eyes, urinary retention. So, anticholinergic effects, basically, is what you're looking for. Maximum effects can take up to 2 weeks. Shake inhaler well. When using 2 different inhaled medications, wait 5 minutes between. If giving via nebulizer, use within 1 hour of reconstitution. Great. Glucocorticoids. So suppresses mucus production, immune response, and adrenal function. So glucocorticoids, you've got prednisone, prednisolone, bedmethasone. Those are your oral ones. Inhales is beclomethasone, budesonide, fluticasone, and triamcinolone. In IV, you've got hydrocortisone, sodium succinate, methylprednisolone, sodium succinate, and betamethasone, sodium phosphate. All right, respiratory uses. Short term is status asthmaticus for IV. Oral is following acute attack. Long term inhaled is prophylaxis of asthma. Oral is treatment of chronic asthma, obviously long acting. Precautions: patients who have diabetes may require higher doses. Never stop the med abruptly. Side effects: euphoria, insomnia, psychotic behavior, hyperglycemia, peptic ulcer, fluid retention, withdrawal, increased appetite. Do not take with NSAIDs. Teach the patient about gradual reduction of dose to prevent Addisonian crisis. Mm, wow. God. So, okay. Mm, let's see. Excuse me. An Addisonian crisis, by the way, would look like fatigue, muscle weakness, um, hypotension, hyperpigmentation, weight loss, because it needs to be added on. And then Cushing's is that like big buffalo hump, the moon face, um, easy bruising. They just look kind of swollen, honestly. To be fair, they kind of look like me, but I don't have Addison's. Yeah. Let's see. Hmm. Yeah, here we are. Leukotriene modifiers. Let's use the other one again. Decrease inflammation, bronchoconstriction, airway edema, mucus production. So we have for leukotriene modifiers Monteliacast, Zofirulocast, and Saluton. Okay. Monteliacast can be given for anyone over 1. Zoluton can be given to patients 12 and older, and Zofirulocast can be given to kids 5 and older. And it's long-term asthma and prevents exercise-induced bronchospasms. It's not for an acute. Phenobarbital will decrease circulating levels of Monteliacast. Xylitol and Zofirulocast, there's a high risk of liver disease, increased warfarin effects, and theophylline toxicity. Side effects and adverse effects, elevated liver enzymes. So watch your ASTs, your ALTs. Warfarin and theophylline toxicity, I said, may increase levels of beta blockers leading to hypotension and bradycardia of animal. Okay, yeah. Don't abruptly stop. Take daily in the evening. If using the oral granules, pour directly into the mouth or mix with cold soft foods. Okay. Use open packets within 15 minutes. Okay, let's see. Antitussives, expectorants, and mucolytics. Antitussives, you've got hydrocodone and codeine, and that's gonna suppress the cough, basically. Expectorants, you got guaifenesin, promotes increased mucus secretion. Mucolytics, acetylcysteine, and hypertonic saline. Can be used for CF, cystic fibrosis. Antidote for acetaminophen poisoning. And then acute and chronic pulmonary disorders with copious secretions. Oh my gosh. because it's going to enhance the flow of secretions. Patients younger than 2, only saline solutions should be used. Opioid antitussives, potential for abuse, of course, and use caution with over-the-counter meds. They could experience drowsiness, dizziness, aspiration, and bronchospasm risk with mucolytics, constipation, promote fluid intake. Let's see. Decongestants like phenylephrine, pseudoephedrine, Mefazoline. It's used for allergic rhinitis, sinusitis, and common cold because it's reducing inflammation of the nasal membranes. Products with pseudoephedrine should not be used longer than 7 days. It's contraindicated with closed ankle glaucoma and used cautiously with hypertension, CAD, and dysrhythmias, coronary artery disease, and dysrhythmias. Side effects: dry mouth, restlessness, insomnia. Don't use longer than 3 to 5 days to avoid rebound congestion. And topical agents work faster and have a shorter duration, of course. Antihistamines, almost done with this section. Antihistamines: diphenhydramine, loratadine, cetirizine, fexofenadine, and desloratadine. Relieve and prevent hypersensitivity reactions. It decreases the allergic response by competing for histamine receptor sites. They have nothing to latch onto, you can have a reaction, basically. Use caution with hypertension, glaucoma, PUD, peptic ulcer disease, and urinary retention. Children may have excitation, hallucinations, incoordination, potential seizures. Avoid alcohol. Watching again for those anticholinergic effects and drowsiness. So, excuse me. Dying. Okay. Okay. What was I saying? Anticholinergic effects and drowsiness. Yeah, the side effects of antihistamines. And again, anticholinergic effects just means like kind of like high and dry, basically. So, high blood pressure, dry mouth, constipation, that kind of things, just high and dry. Monitor for hypokalemia, monitor blood pressure, how to manage anticholinergic effects. Take at night. Okay, that section was done. Yeah, maps for the pharmacist. Neurologic. Interesting. GI, urinary, immune, musculoskeletal, nervous, inflammation, alternative therapies. Okay, honestly, not that bad, but I think I'm going to use a different highlighter for that. This one, honestly, I'm probably going to have to get rid of soon. Excuse me. Oh, yeah. Again, not that anyone's going to see this or is going to care, but I am a stationary and a few other things fiend, basically. I do actually use these, though. I'm not like one of them that just like collects and doesn't use stuff. But anyway, All right, let's see. What highlighter color do I want? Got this. Got this. Got this. Sure, I have another one somewhere. My brain is not braining to the point where I can think, oh, here you are, my darlings. Yeah, the other ones are just kind of like Sharpies or Sharpie pens. So I'm just going to hang out right there. Double check. So you're different than the others. I don't necessarily like that. But whatever. My other options. Just did yellow, pink. Let's go with the green. It's my favorite color after all. So, medications for the endocrine system. Let's do it. So, endocrine system. So, oral hypoglycemics. So, what do we think of when we think of endocrine system? Diabetes. So, use in conjunction with diet and exercise to control glucose levels in clients who have type 2 diabetes mellitus. DM, as it will be shortened. Or T2. Yes, I speak English. T2DM. Let's see. Oral hypoglycemic. So alpha glucosidase inhibitors, so microbose and miglitol. Slows carb absorption and digestion. We got biconize, so metformin reduces gluconeogenesis and makes it more sensitive to insulin. Gliptins, you got sitagliptin, so promotes the release of insulin, lowers glucagon secretion, and slows gastric emptying. You got meglitinides, repaglinide, and metaglinide. It stimulates the beta cells to release insulin, which is great. Importantly, these are short-acting, so administered before each meal. There's a risk of hypoglycemia. Sulfonylureas, so you've got your glipizide and glyburide. It promotes the release of insulin from the pancreas. But there is an extreme high risk of hypoglycemia in patients with renal, hepatic, or adrenal disorders and can cause a disulfiram-like reaction with alcohol ingestion. So disulfiram. And then you got your thiazolidinediones. Thiazolidinediones. Rosiglitazone. Rosiglitazone and pioglitazone. It decreases cellular insulin resistance. Precautions, indications, exacerbation of heart failure. Encourage diet and exercise. Monitor their HbA1c. Refer to diabetic nurse educator. Teach science and management for hypoglycemia, especially with sulfonylureas. Great. Oh, this one got kind of dark. Let me switch. Maybe I'll do this. It works better on other paper, but these little, what's it called, notebooks are not. Insulin. That's kind of dark too. Let me see. I don't know, they're all dark. Whatever. So, insulin rapid, you have Lispro, short, you have regular, intermediate, you got NPH, and long, you got glargine. Those are your big ones. That's what you need to know. Like, I don't know what to tell you. Um, let's see. You'll see, like in the hospital, most of the ones I've been to, you'll see like humulin, and then you'll know which one it is because it'll have a letter after it. So they'll have like humulin R, so regular, or humulin, I don't know, like H or something. But just you might see those. Oh yes, importantly, let's switch back to this pink. This stuff is, because the other stuff is dark and it's bleeding through basically to the other side. When mixing regular with NPH insulin, draw up the regular first. Do not mix other insulins with Lispro, glargine, or the 70-30 combo. The only insulin given IV is regular, and glargine is at bedtime. Monitor for hypo and hyperglycemia and lipodystrophy, or lipodystrophy, however you want to say it. You want to roll the vial of insulin, except regular, to mix it. Rotate injection sites. Same service before. Monitor glucose levels before meals and at bedtime. A pattern schedule specific to the patient. Right. Glycemic agents. Like glucagon is to promote breakdown of glycogen to glucose, leading in increased serum glucose levels. It's used for emergency treatment of severe hypoglycemia. Watch for nausea, vomiting, and rebound hypoglycemia. Give for unresponsive patient, monitor blood glucose. Teach them to monitor for early signs of hypoglycemia. Wear their med alert bracelet. How to administer med. And give carbs when they wake up. Cool. Yeah, this one has to go. Oh, it's pretty much dead. And these are not doing how I needed them to, so I'll go back. Which means I'm back to this one. Okay. Okay. Thyroid hormone. Levothyroxine or T4. Used for hypothyroidism and emergency treatment of myxedema coma. Over-medication can, of course, result in what looks like hyperthyroidism. So then the adverse effects, side effects and adverse effects are, of course, tachycardia, restlessness, diarrhea, weight loss, heat intolerance, insomnia, and also decreased bone density. Monitor their cardiac system. It's initiated with low doses, advanced to higher later. Monitor T4 and TSH levels, take in the early morning. Thyroid hormone antagonists. Methimazole inhibits synthesis of thyroid, so it's used for hyperthyroidism, pre-op thyroidectomy, thyrotoxic crisis, and thyroid storm, of course. Caution with bone marrow disorder, hepatic disease, or bleeding disorders. DC it prior to radioactive iodine uptake testing. Side and adverse effects: skin rash, pruritus, abnormal hair loss, GI upset, paresthesia, periorbital edema, joint and muscle pain, jaundice, agranulocytosis, and thrombocytopenia. Give with food at the same time each day. Increase fluids to 3 liters a day. Avoid over-the-counter products with iodine. Must be tapered off. Monitor for a therapeutic response, which is weight gain, decreased pulse, and blood pressure, and T4 levels. Overdose, signs of hypothyroid, which is periorbital edema, cold intolerance, and mental depression. Okay. Anterior pituitary growth hormones, here's somatropin. It's used for Turner syndrome and growth hormone deficiencies. Contraindicated in patients who are severely obese, must be discontinued prior to epiphyseal closure. Avoid concurrent use of glucocorticoids. Side effects, adverse effects, hyperglycemia, and hypothyroidism. Monitor growth patterns, reconstitute med per manufacturer instructions. Admin sub-Q, and doses individualized. Posterior pituitary hormones or antidiuretic hormones. Promotes reabsorption of water in the kidneys, vasoconstriction, or vascular smooth muscle. So desmopressin or DDAPP and vasopressin is used for DI, diabetes insipidus, cardiac arrest, nocturnal emesis, and hemophilia. You're going to use the desmopressin. Contraindicated in patients with chronic nephritis or high risk for an MI. You're going to monitor for hypernatremia, seizures, and coma. Monitor the USG, the urine specific gravity, the blood pressure, the UOP, the urinary output. Prevent hyponatremia due to water intoxication. Instruct for use of nasal spray. Adrenal hormone replacement. Dexamethasone, hydrocortisone, sodium succinate, fluorocortisone acetate, and prednisone. Acute and chronic replacement for adrenal cortical insufficiency, aka Addison's disease, inflammation, allergic reaction, and cancer. Requires higher doses in acute illness or extreme stress. Monitor for adrenal suppression when given for inflammation and allergic reactions. Monitor for infection, hyperglycemia, osteoporosis, GI bleed, fluid retention. Don't skip doses. Monitor blood pressure. Monitor fluid and electrolyte. Weight output. Monitor for signs of bleeding and GI discomfort. Importantly, take calcium supplements, maintain vitamin D levels, give with food, taper off the dose, immune protection. Great. Need to launch it. System. There's quite a bit left, but I with that section. I have, of course, been putting off this section because, why not? But anyway, I think that's it for today. Well, for me recording anyway, I'll still study, but not with this. Again, not that anyone will see this, but if you did, thanks for watching and listening to my ramblings. Okay, bye bye.